Hello again, everyone. We are Group 9, and we are continuing the discussion of our coupled wearable TSH sensor and levothyroxine pump. There are about 3 million cases of hypothyroidism across the United States. Patients with hypothyroidism cannot effectively produce their own thyroxine hormone, which impacts brain development, digestion, bone support, and heart and muscle function. The drug levothyroxine is a replacement hormone that will enter multiple cell types of the body to influence transcription and cell metabolism. Current competing treatments include daily oral intake of tablets, or in cases of severe hypothyroidism or in patients with malabsorption, a daily injection must be given in a clinical setting. Traveling to a clinic for a daily injection is especially inconvenient, so our levothyroxine pump-based drug delivery system is more convenient, portable, and includes a thyroid stimulating hormone sensor, so it is able to suggest the optimum dosage at a given time.
Our design is based on insulin pumps with a transmitting glucose meter, which is what we use to base our design, and you can see that in this slide. Our two-part design features a TSH sensor that will inform the pump of the suggested dosage of levothyroxine, and the user will then confirm the dosage, and then the levothyroxine will be dispensed. The dosage options will be preset by a doctor to have a minimum and a maximum dosage based on the patient's needs, and this will minimize under or overdosing caused by potential patient error. The pump will also be programmed by a software design team to handle the signal from the TSH sensor and the dosing. Also, the pump will be programmed to remind the user to replace the needles, batteries, and tubing of both the sensor and the pump when necessary. This design is minimally invasive, it does not encumber the wearer, and includes important alerts for the ease of use for the patients.
We will make the needle out of 316 stainless steel because of its high corrosion resistance over the course of 4 weeks. It also has 316L stainless steel also has high tensile strength and fracture toughness, which is ideal for a short needle. Our pump tubing would be made out of medical grade polyvinyl chloride because it doesn't release any toxic particles within 1 to 4 weeks, and it would be replaced weekly. As for our adhesive, we would use a silicone-based adhesive because it's non-toxic on the skin, has high adhesion properties, and does not induce a sensitivity response. Silicone is also a good insulator, and levothyroxine must be kept at a temperature cooler than body temperature, so insulating the levothyroxine in silicone could help keep it at that low temperature. The biocompatibility testing we would have to perform include cytotoxicity, sensitization, corrosion, degradation, and hemocompatibility tests. These tests would follow the FDA clinical trial guidelines, and we would get our sponsorship from the American Thyroid Association.
So in creating this device, we estimate that it would take approximately 3.5 years to complete production and cost about $45 million. Comparing the annual costs of each treatment type, oral tablets will cost approximately $912. Daily injections would be estimated at about $45,000, and our pump device, excluding the initial cost of $3,000 to $6,000 for the device itself, it will range from $3,000 to $6,000. Despite the high cost to the patient, benefits of our device include convenience of an at-home and portable device, especially for special cases of hypothyroidism, and will dispense a custom dosage that accounts for metabolism of previous dosages and other day-to-day fluctuations. The pump will also have a program feature to remind patients to replace worn parts. A TSH sensor can also serve as a potential warning system if there is a drastic change in needed dosage that requires medical insight. And here's a list of our references that we used. Thank you all so much for your time, and we are now open for any questions.